Hi, it's Dr. William. This is a round 2 BBL, and I just want to talk to you about just a simple concept which I refer to as fat maldistribution. With her first BBL, what she didn't like, and personally I don't like either, and I agreed with her, and that's why I said I think I can help you. This side I've already injected, this side I have not injected. What I found with her standing, and you can see it here with her laying down, is that she had a fair amount of fat put up high in this area, which is appropriate. In fact, when I did this side, I put more fat in here as well. But the area that I think where the fat wasn't placed during the first BBL is in this area. And this is, I see this very frequently. And so this area here becomes very hollow. And when she's standing, this is really kind of almost like an indentation here. So she has a nice shape, everything's good up here, and then all of a sudden it kind of comes in here. So she's got some projection, she has some volume, but it's hollow in this area, and then it doesn't blend into her leg. So I haven't injected here, I'm going to do that now. I'll show you on this side. And by placing fat into this area, actually this side was more hollow, but by placing fat into this area, now what we've done is just kind of balance the gluteal area a lot more, and I blended it into her leg. And so here you'll see this is hollow here. She has a little fat deposit here, which I think is nice, and we use that, but then it's also flat in the leg as well. So you kind of get this line that comes up that's flat here, comes out here, flat in here, and then goes out. I don't want that. I like a nice smooth line as this goes, a nice transition from the top part of the butt to the lower part of the butt, and from the lower part of the butt into the leg to get just a nice smooth OG line here. I don't know if you can see, but if you look at her, I mean, I can see it pretty clearly here. You can just see that area here that's hollow, and she had the same thing here, but I filled that in. And so now, also, she didn't have as much lipo in the key area. The lipo in the key area really rounds out the top part of the butt, and then by filling this in, it rounds out the bottom part, and then you have to blend that into the leg so you get a nice smooth transition, because we don't really want any step-offs in this area. Now, she's got a little tiny hollowness here that I've been working on. I couldn't quite get it to go. I think when she stands up, and you'll see it, I think that line will still be pretty smooth throughout this whole area. So that's what I'm gonna do. Second round, you know, we're doing lipo through the key area, which will round the butt. We're adding more volume, we're getting more projection because of the volume we add. And then usually in a second round, we're dealing with some fat malposition, and that is adding more fat to this area and then blending that and kind of sweeping that into the leg so we get that nice smooth OG line. All right, let's look and see how we did here, because this was not 100% successful, and not everything is 100% successful, and this is a case where it didn't work out as well as I wanted to. The interesting thing is, and this happens this happens more often than not, is patients can be extremely happy even though sometimes the surgeon is not happy. So I'm not fully happy with the way I was able to get her tissue to pop out, but she is thrilled. She didn't want to do a video, so we're going to use her still images here, but she was very, very happy. But I'm going to show you why I'm a little bit disappointed in terms of what I was able to do, and it's really a function of her tissue. So if we look here in the before photo, so this is her before photo, and this is her after. I think it's important to realize immediately from the get-go that she has a nice shape change. I like her shape. And if we look at her shape here, I think that she does have a nice OG line that's coming down. And it's better than she had in her original line. So I'm happy with that. Where I am a little bit disappointed is really in these areas where I was really trying to fill them in more. And remember, she had a lot of fat. If you look at her before photo, she had a lot of fat in her upper part of her butt. She was very kind of top heavy in this area, and this area here was very deficient. And so I was really trying to focus on these areas to try to be able to bring these ones out. And I just didn't have as much success in bringing those out as I wanted to. So you know, sometimes you have to accept a defeat because the tissue won't cooperate, and you're putting fat in there and you're wanting to pop out, but it won't pop out. Now, what I said to her, and again, she's very happy, so she's not really looking to do anything. And I also don't want her to make her feel bad and make a big deal and say like, oh, gee, I couldn't do it the way I wanted to do it, or, you know, make her feel that something was not done properly. I just said, gee, I wish these had come out. She's happy. I said, if you do want to, in maybe 2 or even 3 years, we could go back and get a little bit more fat. We wouldn't really need that much fat. Get a little bit more fat and place it into these areas to try to get her a little bit fuller and a little bit smoother in that area. So she had a nice result with, if we look at like the key area here, that was taken down. You can see that this key area was taken down nicely, and that gave her more rounding. She had a lot of fat removed. She has a much better shape. She has a little bit more volume, a little bit projection. So I think the surgery itself was a success, just wasn't able to quite get those 2 little areas, and it doesn't always work out that way.